Hello everyone, and welcome. Today, we're going to talk about a very common and important medication that many of you might be taking, diuretics, often called water pills. We'll explore why these medications are so vital, especially if you have heart failure or high blood pressure. More importantly, we'll focus on how to use them safely and effectively, particularly when it comes to managing your body's essential minerals, called electrolytes. Our goal is to empower you with the knowledge to partner with your healthcare team for the best possible health outcomes. So, what exactly are diuretics? In simple terms, they are medications that help your kidneys get rid of extra fluid and sodium, that's salt, from your body. Think of it like flushing out excess water. If you have congestive heart failure, or CHF, your heart isn't pumping as strongly as it should, which can cause fluid to back up. This leads to swelling in your legs, ankles, and sometimes even fluid in your lungs, making it hard to breathe. Diuretics are crucial here because they help remove this extra fluid, reducing swelling and easing the burden on your heart. It's like relieving pressure in a crowded room. If you have high blood pressure, or hypertension, diuretics work primarily by helping your kidneys remove excess sodium and water from your body. This reduces the total amount of fluid in your blood vessels, which in turn lowers blood pressure. Some diuretics also have a relaxing effect on your blood vessels, further contributing to this blood pressure reduction. Ultimately, by reducing this fluid volume, diuretics help your heart and arteries work more easily. Now, here's where the balancing act comes in. While diuretics are incredibly helpful for managing fluid, they also introduce a challenge, the risk of electrolyte imbalances. Electrolytes are simply essential minerals, things like potassium, magnesium, calcium, and sodium, that have an electrical charge. They're dissolved in your body fluids and are absolutely vital for countless bodily functions. They help your heart beat steadily, allow your nerves and muscles to work correctly, and are key to maintaining the right balance of fluids inside and outside your cells. Because diuretics work by making your kidneys flush out excess sodium and water, there's an unintentional side effect: your body can also lose these crucial electrolytes. When these levels get too high or too low, it can lead to serious health issues. Let's look at a few of the most important electrolytes and what can happen if their levels get out of balance due to diuretics. First, potassium. This is perhaps the electrolyte we talk about most with diuretics. If your potassium levels get too low, a condition called hypokalemia, it can cause very serious problems like irregular heartbeats, which are also known as cardiac arrhythmias, and can also lead to muscle weakness. On the flip side, if your potassium levels get too high, which is called hyperkalemia, this also poses a significant risk for dangerous heart rhythm problems. Both extremes need immediate attention. Next, magnesium. When magnesium levels are too low, or hypomagnesemia, you might experience muscle cramps, persistent fatigue, and it can also contribute to heart rhythm disturbances. And finally, sodium. It might seem paradoxical, but even though diuretics help remove sodium from your body, sometimes they can cause your blood sodium levels to drop too low, a condition called hyponatremia. This often happens if you lose too much water, and it can lead to symptoms like confusion and fatigue. In some cases, low sodium can actually mean you have too much fluid overall in your body, even if you don't feel swollen. There are different types of diuretics, and they work in various ways, which means they can affect your electrolytes differently. Knowing your specific diuretic type can help you understand what to watch for. Loop diuretics, like furosemide, are often considered the strongest water pills. They are very effective at removing large amounts of fluid quickly, but they can lead to the loss of not just sodium and water, but also important minerals like potassium and magnesium. Thiazide diuretics, such as hydrochlorothiazide, are commonly prescribed for high blood pressure. Similar to loop diuretics, they can also cause you to lose potassium and magnesium. With long-term use, especially at higher doses, they can sometimes lead to increased blood sugar levels or elevated uric acid, which can trigger gout attacks. Your doctor will monitor for these effects. Then we have potassium-sparing diuretics, like spironolactone or eplerenone. These are unique because while they help remove fluid, they also help your body hold on to potassium. They've been shown to improve survival in heart failure patients by blocking certain hormones. However, because they spare potassium, we need to be careful about potassium levels getting too high, especially if you're taking other medications that also increase potassium. And finally, there are newer medications, like SGLT2 inhibitors, for example, Jardiance. While not traditionally called diuretics, they also help your body remove extra fluid and sodium primarily through the kidneys. What's good about these is they generally have a more favorable effect on your electrolyte balance, meaning they're typically not associated with significant potassium or magnesium loss. It's absolutely vital that you and your caregivers know the warning signs of an electrolyte imbalance. These can be serious and often require prompt medical attention. Watch out for unexplained muscle weakness that seems unusual for you, or a feeling of persistent fatigue that just won't go away. Your muscles need those electrolytes to function properly. Pay close attention to your heart. If you notice new or worsening heart palpitations, that means your heart feels like it's skipping beats, racing, or fluttering. It could be a sign of an electrolyte problem affecting your heart's electrical system. Any sudden changes in your mental clarity, such as new confusion, disorientation, or unusual dizziness, should also be reported immediately. These can sometimes indicate low sodium levels. While less common, severe nausea or vomiting that's unusual for you could also be a sign. If you experience any of these symptoms, especially if they are new or getting worse, it's crucial to contact your healthcare team right away. Don't wait. Now let's talk about the strategies your healthcare team uses, and you participate in, to keep your electrolytes in balance. Monitoring is absolutely key to your safety. The most important tool is regular blood tests. These tests will check all your important electrolyte levels, like sodium, potassium, magnesium, and calcium. They also check your kidney function using tests like creatinine and eGFR, which tell us how well your kidneys are filtering waste from your blood. Healthy kidneys are essential for managing fluids and electrolytes. The frequency of these tests will vary. When you first start a diuretic, or if your dose changes significantly, you'll likely have tests done within 1 to 3 days to see how your body is responding. After that, monitoring might be weekly for a few weeks, then monthly for a few months, and once your levels are stable and your treatment is consistent, it might be every 3 to 6 months. However, if you develop new or worsening symptoms, start any new medications, especially those that can affect your kidneys or potassium, like certain over-the-counter pain relievers called NSAIDs, or if your kidney function changes, your doctor will order tests more frequently. These results directly guide your treatment. It's also important for you to know your numbers. Ask your doctor or nurse what your specific target ranges are for your electrolytes and what levels should prompt you to call them. Understanding your results is empowering. Beyond monitoring, there are specific medication and dietary strategies to help maintain electrolyte balance. Your doctor might prescribe targeted supplements. If your blood tests show low levels, they might give you potassium, magnesium, or occasionally calcium supplements. These can be given by mouth, or in more severe cases, through and for, depending on how low your levels are and if you're having symptoms. Dietary management plays a significant role. Eating foods naturally rich in potassium, like bananas, oranges, potatoes, and leafy green vegetables, can be helpful if you're prone to low potassium. Similarly, magnesium-rich foods like nuts, whole grains, and dark chocolate can contribute. And it's crucial to strictly follow your doctor's advice on sodium restrictions, often less than 2,000 milligrams per day, to help manage fluid and blood pressure. However, It's very important to always talk to your healthcare provider before making big dietary changes or taking over-the-counter supplements, especially for potassium. Too much potassium can be just as dangerous as too little, especially if you're on certain diuretics or other heart medications. Managing your fluids is another crucial part of this balancing act. Your healthcare team will provide you with individualized fluid goals. This means they'll tell you how much fluid you should be drinking each day. The goal is to drink enough to stay hydrated, but not so much that it worsens fluid buildup or makes low sodium levels worse. For some patients, particularly those with more advanced heart failure, frequent fluid buildup, or low blood sodium levels, your doctor might recommend a fluid restriction. This means actively limiting the total amount of fluid you consume each day, sometimes to 1.5 to 2 liters. It's important to understand that not everyone needs a fluid restriction, and if you do, it must be carefully tailored to your individual needs by your doctor. Remember, it's not just about water. Many foods contain hidden fluids that count towards your daily limit. This includes obvious things like soups, teas, and juices, but also foods that melt at room temperature like ice cream, popsicles, gelatin, and even very juicy fruits like watermelon. If you're on a fluid restriction and you find yourself very thirsty, here are some tips. Try to sip your drink slowly instead of gulping. Suck on ice chips, remember they count towards your fluid limit. Chew sugar-free gum, or rinse your mouth with water without swallowing. Avoiding very salty foods will also help manage thirst. Your kidney function is deeply connected to your electrolyte balance and how well your diuretics work. In patients with heart failure, especially if you also have existing or developing kidney problems, this relationship becomes even more critical. Your kidneys are like your body's filters. They're in charge of how much fluid and how many electrolytes your body keeps or gets rid of. If your kidneys aren't working as efficiently, it can significantly impact how your diuretics perform and your electrolyte levels. Specifically, kidney problems can lead to reduced diuretic effectiveness. This means your water pills might not remove enough fluid, sometimes requiring your doctor to prescribe higher doses or different combinations of diuretics to get the job done. You also face an increased risk of electrolyte imbalances. Because your kidneys are less able to properly regulate electrolytes, meaning they can't efficiently remove excess or hold on to what you need, even standard diuretic doses can lead to more noticeable or rapidly developing electrolyte issues. For example, if your kidney function is very limited, certain medications, including some diuretics, carry a much higher risk of high potassium because your kidneys can't efficiently remove the excess. This means there's a constant need for careful dose adjustment. Your diuretic dosages and choices must be carefully adjusted based on how well your kidneys are working, your eGFR, as some diuretics are mainly removed from your body by the kidneys. Ignoring declining kidney function can lead to too much medication building up in your system and increased side effects. Now, let's talk about your crucial role in managing your health at home. You are the most important player on your healthcare team. And one of the simplest, yet most powerful, things you can do is daily weight monitoring. Think of your daily weight as your early warning system for fluid changes. For individuals with heart failure or significant fluid retention, it's the very first sign that your body might be holding on to too much fluid. It often appears even before you feel swollen or breathless. But it's equally vital for anyone on diuretics to ensure the medication is working correctly without causing you to lose too much fluid. Consistent tracking helps your doctor know if your diuretic dose is just right. Here's how to do it correctly. Weigh yourself every single morning at the same time, ideally after you wake up, use the restroom, and before you eat or drink anything. Always use the same scale, placed on a hard, flat surface, not on carpet, for accuracy. Wear similar clothing each time, or no clothing at all, for the most consistent reading. And immediately record your weight in a logbook, calendar, or a health app. It's vital to know when to call your doctor for any weight changes. You will get to know your dry weight, your ideal weight when fluid is well controlled. Your doctor will give you specific weight limits, but generally, you should call your healthcare provider if you experience. For weight gain, you should call if you gain 2 to 3 pounds in one day, or 5 pounds in 1 week. Even small, sudden increases can signal fluid retention that needs attention. But also, for weight loss, you must also call if you experience sudden or unexplained weight loss. For instance, losing more than 2 to 3 pounds over just a few days, or any significant, unintentional loss that goes below your dry weight. This is important because it could indicate a few things. Overdiuresis. Your diuretics might be too strong, causing you to lose too much fluid, which can lead to dehydration, kidney problems, or dangerous electrolyte imbalances. Cardiac cachexia. In advanced heart failure, unexplained loss of muscle and fat, not just fluid, can occur. This is a very serious sign of disease progression and needs immediate medical evaluation. Or it could signal other underlying medical issues that need to be addressed. Report any significant, unplanned weight loss immediately, especially if it's accompanied by symptoms like dizziness, lightheadedness, excessive thirst, or unusual fatigue. Beyond weight checks, managing your medications correctly and recognizing other signs of fluid overload are crucial parts of your role at home. First, master your medications. Consistency is key. Use a pill organizer or set reminders on your phone or with an app to help you remember. Try to take your medications at the same time each day, linking it to an existing habit like breakfast or bedtime. Always plan for refills well in advance so you don't run out. And most importantly, if you are ever unsure about a medication, its purpose, how to take it, or potential side effects, please ask your pharmacist or doctor. Don't guess. Second, be aware of other ways your body might tell you it's holding too much fluid, beyond just weight gain. Look for increased swelling, or edema, in your ankles, feet, legs, hands, or even your abdomen. If you press on a swollen area and it leaves a temporary dent, that's called pitting edema. Pay attention to worsening shortness of breath, especially with activity, or if you find yourself needing more pillows to sleep comfortably at night because lying flat makes you breathless. A new or persistent cough, which might produce white or pink, foamy mucus, can also be a sign. You might also notice your rings feel tighter, your shoes are difficult to put on, or you simply feel bloated or nauseous due to fluid buildup in your abdomen. These signs should prompt a call to your healthcare team. When your doctor advises on sodium restrictions, it's not just about avoiding the salt shaker. A huge portion of the sodium we consume is actually hidden in processed foods. This is incredibly important when you're managing fluid with diuretics. Think about common culprits like canned soups, frozen meals, cured meats such as bacon or deli meats, fast food, and even many restaurant meals. Condiments like ketchup and soy sauce, and salad dressings, are often surprisingly high in sodium. Even many baked goods can contain significant amounts. Your action item here is to always read food labels carefully. Look for terms like low sodium, reduced sodium, or no added salt when you're grocery shopping. Meeting with a registered dietitian can be incredibly helpful for personalized guidance on how to follow a heart-healthy, low-sodium diet and identify these hidden sources. Managing heart failure and hypertension with diuretics truly is a team effort, and I want to emphasize that you are the most important player on that team. Your active participation and communication are vital. Maintain close collaboration with your healthcare team. Don't hesitate to share any symptoms, concerns, or questions you have. Bring your daily weight logs and any notes about how you're feeling to your appointments. Your honesty and diligence provide them with invaluable information to adjust your treatment plan. Your healthcare team should also proactively provide you with education. This includes understanding the specific electrolyte risks associated with your prescribed diuretics, knowing which warning symptoms need immediate medical attention, personalized dietary and fluid management guidelines, and the frequency and importance of your laboratory monitoring. Finally, involve your support system. A trusted family member or close friend can be an incredible asset. They can help you remember medications and appointments, support you in making healthy, low-sodium food choices, and learn to recognize your symptoms and know when to seek help. Empowering your support system means you have an extra set of eyes and ears, ensuring you get timely care when needed. To sum up our discussion, here are the key takeaways to remember about staying safe on diuretics. First, diuretics are vital medications for managing heart failure and high blood pressure, but they can affect your electrolyte levels. Second, monitor your weight regularly. Daily weight checks are especially important for heart failure patients as an early warning system for fluid buildup. Report any sudden, significant changes to your doctor. Third, get your lab tests done regularly. These blood tests are crucial for checking your electrolytes and kidney function. Make sure you understand your specific target numbers and when to call your doctor if they are too high or too low. Fourth, manage your fluid and sodium intake precisely as advised by your healthcare team. This is a critical part of the balancing act. Fifth, know the warning signs of electrolyte imbalance or fluid overload/excessive fluid loss. Pay attention to changes in muscle strength, fatigue, heart rhythm, or mental clarity, and report them promptly. And finally, work closely with your healthcare team. They are your most important partners in guiding your treatment, making necessary adjustments, and ensuring your safety.